I almost always hear questions about, okay, that's great, but when can I return to play? Return to play discussion is crucial for these athletes. They want to know when they can go back to play. That's what they came to you for, so that they can get back on the field as quickly as possible. The Zurich statement, published several years ago, states that there really are 4 individual steps that all athletes must complete before they can go back into sport again. This has been agreed upon internationally by experts in the field, and I think it's very important that before an athlete leaves, even after the very first evaluation, that they understand what these steps mean. The first step is they have to feel completely normal. That's very important to emphasize to them that it's completely normal. Athletes oftentimes are asked, how do you feel? And they say, I'm doing fine, or I'm okay. But when you ask them more questions, they still have a low-grade headache, or they may not be sleeping well, or they're not caught up in school yet, and it's still a significant stressor for them. You have to have them convince you that they feel completely normal. I oftentimes depend on their parents or even their siblings to see if they believe that from their perspective that the athlete is acting normal as well. So not only feeling normally, but they're acting normally is number one. They have to have a completely normal neurologic exam. The neurologic exam is what you've defined in the clinic that your clinic is going to proceed with, but it has to be normal. They can't have pretty good balance on one side and horrible balance on the other side, and we're going to call that normal. It has to be a normal exam. Their visual ocular motor screen has to be normal. Their neurocognitive testing is the third step, and that has to be back to baseline. We don't say normal or abnormal about neurocognitive testing, we say back to baseline. Generally, most athletes have a baseline on file, and clinicians that are very astute at interpreting the test can actually interpret the test without a baseline, but it's better to do it with a baseline. So those athletes have to be back to baseline. The fourth step, which I think has been overlooked for a long time and is becoming much more prominent in the research, is exertion. Exerting your athletes after they feel normal and they have a normal neurologic exam and they have normal neurocognitive testing is a hallmark for their return back to play. The brain is very sensitive to when blood shifts and goes to other parts of the body, and you can drive symptoms significantly with athletes. This is a really important time for you to believe your athletes and tell them that they have to tell you the truth. Athletes can lie about this. They can go through the progressive exertion and tell you that they feel completely normal, and we have no other way to know that. I tell all my athletes that I need to understand if they have any signs or symptoms that occur when they return back to their physical activity.